Do you know what tuberculosis is and how it affects millions around the world? Today we plunge into the depths of this infectious disease, shedding light on its causes, diagnosis, treatment, and the first line of drugs used to combat it, including their side effects. Tuberculosis, often known as TB, is a potent bacterial infection caused by Mycobacterium tuberculosis. This microscopic culprit invades and attacks your lungs primarily, but it doesn't stop there. Given the chance, it can spread to other organs, causing havoc in your body. So you might wonder, how does this bacterium make its way into our bodies? The answer lies in the air we breathe. When a person with active TB disease in their lungs or throat coughs, sneezes, speaks, or sings, they propel the TB bacteria into the air. Inhaling these bacteria-laden droplets is often the first step towards infection. Now, not everyone who inhales TB bacteria becomes sick. A strong and healthy immune system often walls off the bacteria, creating a latent TB infection. Though non-contagious, this latent infection can turn into active TB disease if the immune system weakens. Moving on to the diagnosis of tuberculosis, it typically involves a skin test or a blood test. In a skin test, a small amount of fluid, called tuberculin, is injected into the skin on your lower arm. A hard raised red bump appearing within 2 to 3 days indicates TB infection. Blood tests, on the other hand, measure how the immune system reacts to the bacteria causing TB. The cornerstone of TB treatment is an approach called DOTS, short for Directly Observed Treatment, short course. This strategy involves taking a combination of drugs for a duration of 6 to 9 months under the supervision of a healthcare provider. Let's delve deeper into the treatment regimen for active and latent tuberculosis, which differs significantly. For active TB, the treatment requires a combination of several drugs, taken for a duration of 6 to 9 months. This is a more intensive treatment approach aimed at completely eradicating the disease. On the other hand, latent TB usually requires just one drug, taken for a period ranging from 3 to 9 months. Although the treatment for latent TB is simpler, it is equally important in preventing the progression of the disease to an active state. The first line of drugs used in this regimen includes isoniazid, rifampin, ethambutol, and pyrazinamide. Each of these drugs plays a crucial role in eliminating the TB bacteria from your system. When the first line of drugs fails to eliminate the TB bacteria, doctors turn to the second-line drugs. These include fluoroquinolones like levofloxacin or moxifloxacin that are effective in fighting against the bacteria. Injectable medications such as amikacin, capreomycin, and kanamycin also play a significant role in the treatment process. Other drugs like ethionamide, cycloserine, and para-aminosalicylic acid are also used. These drugs are the backup, the second line of defense, when treatment with first-line drugs is not sufficient. But remember, they also come with their own set of side effects, which we will discuss in the next scene. Sadly, TB bacteria can develop resistance to the drugs used to treat them, making the disease harder to control. This can be due to various reasons, such as improper use of medication, or the TB bacteria mutating and becoming drug-resistant. This is where we face a challenge called multi-drug resistant TB, or MDR-TB. This is a form of TB that does not respond to at least the 2 most potent TB drugs, isoniazid and rifampin, which are the mainstays of treatment. This can make the treatment process even more complex and lengthy. It's crucial to follow the recommended treatment plan to prevent the development of drug resistance. Remember, TB is a formidable foe, but with the right treatment and adherence, it can be defeated. However, like all medications, these drugs come with their share of side effects. Isoniazid may cause numbness and tingling in your hands and feet, while rifampin can discolor your urine, sweat, and tears into an orange-red color. Ethambutol might affect your vision, and pyrazinamide can result in joint pain. To recap, tuberculosis is a potentially severe infectious disease caused by the bacterium Mycobacterium tuberculosis. It spreads through the air when a person with TB of the lungs or throat coughs, sneezes, or speaks. Diagnosis involves skin tests or blood tests, and treatment is a combination of first-line drugs taken over 6 to 9 months. These drugs, while effective, can have side effects, underscoring the importance of taking them under the supervision of a healthcare provider. Understanding tuberculosis, its causes and treatments is a vital step in the global fight against this persistent disease. So let's remember to keep learning, stay informed, and do our part in this battle.